3 objectives: adaptive secondary immunity and artificial immunity. Describe the differences between primary and secondary immune response. Explain the difference in the primary and secondary immune response. And describe the role of vaccination in providing passive and active artificial immunity. So, the secondary response is an adaptive secondary immunity. The secondary response occurs when a person is exposed to the same antigen for the second time. In a secondary response, you can see that more antibodies are produced and more quickly. So this line is steeper and it also goes higher. So more antibodies are produced and they're produced more quickly and they stay in the blood for longer. The antigen is normally eliminated before any symptoms develop in the secondary immune response because the person is said to be immune. But however, some pathogens, like the cold virus, change the shape of their antigens very quickly. They mutate their antigens and they have high antigenic variability. So the secondary response is not effective against them. So things like the flu vaccine that has to be taken every year because of the fact that they mutate and therefore the antigens change shape. Therefore, our antibodies don't recognize, or the B cells don't recognize that particular antigen. But if it's something like chickenpox or meningitis B or something like that, once you've got immunity from either natural immunity from chickenpox or artificial immunity from the meningitis B vaccine, you shouldn't get it again because you've already done that primary immune response, and the secondary immune response will be so quick that you won't have any symptoms. So, here, this is artificial, so this is vaccination such as the meningitis B vaccination. The vaccination is usually a dead or attenuated or weakened strain of the pathogen with the antigens on. Therefore, it will stimulate the primary immune response when you get vaccinated. So it takes quite a while, about 4 to 15 days, to build up enough antibodies. So it's very slow to build up, and also not very many antibodies are produced. So it's a slow and not very strong reaction. But over time, we produce memory B cells, which remain in our blood for years. And then, if the same pathogen enters the body, so if you get infected, if you get exposed to meningitis B, or if you get exposed to chickenpox or something like that, if you get exposed to the same pathogen again, the response is a lot stronger and more rapid. So it's quicker and stronger than the primary response. So in the second response, you don't get symptoms because your immune response is so quick and effective. So vaccinations, it means that the slow primary response is launched without having any symptoms of the disease because in a vaccinations it's a dead or weakened strain. And that means that you can build up this primary response so that a secondary response can occur when actually exposed to the pathogen. So vaccinations are known as artificial adaptive immunity. This is because memory cells clone quickly and are present in greater numbers and so produce more antibodies more quickly. So, how vaccinations allow active artificial immunity? So, first of all, you've got antigen presenting cells or APCs, which are produced on destruction of a pathogen. An APC binds to receptors on the T lymphocytes. These undergo rapid mitosis and differentiation. There is production of memory T lymphocytes. Activated T lymphocytes stimulate B lymphocytes by releasing cytokines. Memory B cells are produced, which are long lasting and can respond more rapidly and in greater numbers on their second exposure. And plasma cells are also produced, which release antibodies. So passive immunity is when a person receives antibodies to a disease rather than producing their own immune response. So you just get an injection of antibodies to help you along, but it doesn't actually mean that you've got an immune response. So it's very short-lived. So passive immunity develops after you receive antibodies from someone or somewhere else. Natural passive immunity would be, as an example, through breast milk. When a mother is breastfeeding, some antibodies are passed on to the baby. And artificial antibodies can be received from a medicine, for example, from a gamma globulin injection or infusion. So that's if you've got a disease, they'll give you some antibodies to try and help your body attack the pathogen. Natural passive immunity. This is the process of babies receiving antibodies from their mother through the placenta before birth or through breast milk when born. Colostrum is the first type of breast milk produced by expectant mothers towards the end of pregnancy, and it continues until around day 3 after birth. It's a thick and sticky substance and it's full of antibodies. However, the baby's lymphocytes are not activated, so the immunity is short-lived. Then you've got artificial passive immunity. This involves harvesting blood plasma from a patient who has recently recovered from a disease. Their blood will be full of antibodies specific to the antigens of the disease. This blood can be processed and the plasma is removed, and what is known as a serum is formed. And it is this serum that can be given to other patients to help their immune systems destroy the disease. This method can work well when a new virus or bacterial infection emerges, as has been shown recently in the Ebola epidemic and the COVID-19 pandemic. So some example questions. The immune system responds to pathogens by producing antibodies. The human body can also respond to the presence of allergens. Give the name of the type of white blood cell that allows rapid production of antibodies in a secondary immune response. So you could either say memory cells, memory B cells, memory T cells, plasma cells, or effector cells. We've not done I would ignore that one. Explain how antibodies are involved in the destruction of a specific pathogen. Antibodies have an antigen binding site. This attaches to a specific part of a pathogen, which enables phagocytosis or destruction by macrophages.